Welcome back, and we're getting ready to move into our second conversation for today, talking about the relevant health issues and concerns of the Central Health Region in 2016 and what that means for 2017. And with us, we have Dr. Javier Zuniga. Good morning and welcome.
Good morning to you too.
Good morning, Dr. Zuniga.
So let's start off with just a recap of some of the major issues that we saw in 2016 as recorded within the Central Health Region.
So within the Central Health Region, first of all, let me just say that it is specific to Belize District and the Keys. The data that we have recovered is primarily from the BHIS, Belize Health Information System. And we have very little information from the private health facilities. So what we're seeing is that, again, non-communicable diseases, they remain one of the major conditions affecting our population. In terms of the communicable diseases, respiratory infections, gastroenteritis, which would be, for example, the common cold or diarrhea, they remain the common conditions for communicable diseases. But we also see very important is high cases of vaginitis, which would be vaginal infections in women. And those are the major conditions. In terms of the top causes of death, the top causes of death are directly related to the non-communicable diseases. So you have, for example, that two of the major top causes would be cardiovascular diseases, and we also have cancer. At the time we took the data, or the data we've used is up to October 2016, but at that time we had seen also a high incidence of homicides, and that was actually the primary cause of death up until October 2016. So people were dying more from violence than actually from non-communicable diseases. We do expect that to change, however, when we tally the data and we filter the data. We do expect to have a higher number of cases of cardiovascular diseases. And I am suspecting that homicide would be the second major cause of death for our region.
Now, if you're to break down the cardiovascular deaths, is it primarily women, men, age group?
It's both. It's both. So what is common is that most of them have underlying conditions such as diabetes, hypertension, they're obese, or they have high lipids within the bloodstream. So these actually are chronic conditions, but they're also risk factors for cardiovascular diseases.
One of the questions that I would have, based on what you've presented so far, would have to do with some of the diseases. In this case, it would be the mosquito-borne illnesses, Zika, chikungunya, and dengue, and malaria. What are those figures looking like? And if you can contextualize that to the region, Belize and the Keys.
So in terms of vector-borne diseases, what we have seen is that in the case of dengue, there has been a decrease of more than 40% in the confirmed cases. So this is laboratory confirmed, right? In the case of suspected cases, these are cases that we suspect have dengue, but we haven't actually done a laboratory test. We do have, of course, more, but not as compared to 2015, it's less cases, suspected cases. But when we look at the confirmed cases, there has been a decrease of 40%. Now, there is a reason for that. What happened is when we had the public health emergency in terms of Zika, what occurred is we started spraying, we started doing cleanup campaign, we started doing all the
People took precautions.
Exactly. So all the interventions that we always preach to the public was being taken into consideration. And you also see in the data that there's about 29 cases, confirmed cases of Zika. Well, Zika is new to our population, so our population is said to be naive, right? So it spreads easier in terms of we don't have the immune system or immunity is not prepared for it. So we would have seen a higher number of cases of Zika. But the interventions were put into place and we prevented a mass outbreak of Zika as such within our population.
Yeah. Now, there were some, the main concern with Zika, while it is the milder form of the mosquito-borne illnesses and how you feel, the main concern were the potential deformities that could happen if a pregnant woman got infected. We did have some women who were pregnant confirmed with Zika. What has been the situation with that?
So once we actually confirm a pregnant mother to have Zika, we follow and monitor them very closely. I must say that we have had cases of microcephaly, but we cannot confirm that this microcephaly is Zika related. We haven't had a mother who has been pregnant that has delivered a baby with microcephaly, but we have had microcephaly cases.
Is there an increase in the number of babies born with microcephaly for this year, for the past year?
I wouldn't say there is an increase. What we're doing more is more surveillance. So obviously we will detect more cases of babies with microcephaly. But I wouldn't say there is a high number of cases of microcephaly within our population.
When you look at the 2016 calendar in terms of these particular illnesses, and you look at what is to come for this calendar year, 2017, is there anything based on those figures or based on that outlook that stand out to you personally?
Well, when we look at the vector-borne illnesses, we've had 2 years ago we had an outbreak of dengue. That we have seen has decreased, and this is because of the interventions. So if we do put them into place, and people or the population also takes part in, of course, doing what they need to do to prevent these diseases from occurring, you see that there is a decrease in the number of cases. Okay?
So Zika provided an opportunity for people to be vigilant in general about mosquito-borne illnesses, which perhaps led to your decline in dengue.
That's right.
Now, do you keep a sustained effort going? We know this isn't necessary. We still have rains. Typically, this isn't a mosquito season.
That's right.
But do you keep sustained efforts going? We know Zika can last in the body for a long time. It can be sexually transmitted. The unique qualities about this disease.
At the moment, in terms of the surveillance in the health facilities, that continues. In terms of the fogging, the spraying, that has decreased because, of course, as you said, this is not a time of mosquito breeding. When it starts to rain, when we have the rainy season, that's when we start then doing more spraying and more fogging. But we do still have a little one or two cases that pop up, even though we don't have a lot of mosquitoes at this time of the year.
Now, I want to talk about another area that I guess can be seen as an achievement for the Ministry of Health and for the country. It is the rollout of the HPV vaccine. This was seen as a significant achievement for the country, while still with some skepticism and some critics.
Controversy.
So let's talk about what that means for us, especially given the death rate when it comes to cancer, right?
Well, the HPV vaccine, the effects of that vaccine we won't see until
long term,
a couple years down the road. But this is very important, as you well said, the cancer, especially for females, cervical cancer, the major cause is HPV. And so we do expect a significant decrease in HPV infections within this female population, this generation that we're actually vaccinating. But we also expect to have a decrease in cancer at the end of a certain period of time.
Yeah. Now, just to recap, this vaccination was rolled out within the schools with parents' permission. How effective has the education campaign been in getting parents to allow for their young girls to get the vaccine?
it was difficult at first. There was some skepticism, there was some reluctance. People, and the major issue is that people are not aware of what the vaccine is, what it does, how it prevents females from actually getting cancer. And that was the idea that had to be brought across to these parents so that they can understand, this is for their benefit. And it was, as I must say, it was difficult at first, but we have now seen a more increase in the acceptance of the vaccine, which is good.
I think part of the skepticism had to do with introducing this particular vaccine to children and young girls at that age, given the impression that they may be sexually active. I think people had that iffiness, so to speak, with regards to this whole process. And I believe that may have been part of the difficulty for you guys to be able to actually raise that awareness and to be able to convince, in a sense, these young girls to be able to be vaccinated, or their parents for that matter, to allow them to be vaccinated.
That's right, you're totally right. And that was one of the issues, right? Especially in the schools that are run by religious groups. So, but as I said, there is a positive note to it that they are accepting it now. I think it is for the benefit of the entire population as such.
Now, is there a schedule to have a 2017 rollout of the vaccine for the young girls who will now enter the preteen age?
It is, yes, there is in the plan. It is a continuous program. I'm not sure how long it will continue. It will continue because, of course, the financial implications is also there.
Yeah. Now, and I'm always fascinated by the conversation when it comes to this issue, because we have seen in other parts of the world where they have been able to eradicate cervical cancer because it is preventable or comes so low that it's almost non-existent. Whereas in our country, this one preventable form of cancer is still the leading cause of death for women with cancers in this country.
That's right. Now, if you look at if we go to the data, we say that cancer is the third leading cause of death, right? And in females, as you said, yes, cervical is still there as one of the top causes of cancer in females, and also breast cancer. So this is significant in terms of mortality rates in primarily in the female population.
You get it that every year, for instance, during Cancer Awareness Month, we discuss all the various forms of cancer. And cervical cancer, as a result of the human papilloma virus, is one that is a recurrent conversation. But I'm not sure how many Belizeans, in terms of women primarily, are really aware, educated on, the reason why this vaccine is so necessary. When you look at the causes of death from cancer.
That's right. Now, if we look back again and go back to the top communicable diseases, you'll see that vaginal infections is number 5. Right? And this includes, it's non-specific, which means it could be bacterial, it could be a virus, it could be a fungal infection, but it is there. So it is significant. And it is significant also for other outcomes, like, for example, in pregnancy as well. So it could lead to problems with the mother and problems with the fetus as well.
And some infections can actually affect your fertility.
As well.
Is this the first time that this is being listed as one of the top infections?
No, we have seen this trend for a couple of years now. We've been trying to address it. It's kind of difficult in terms of getting people to come in and try to speak about, these types of infections, So when it has to do with private parts, it's kind of difficult, especially for males. So males would tend to not want to come into the clinic, but we want more people to come into the clinic. We want healthy people to come to the clinic so that they could take charge of their health.
What about outreach within the Central Health Region?
We have mobile clinics going, mobile clinics in various services. So we do outpatient services within the rural areas and also urban as well. So we do home visits for people who cannot come into the clinic, or in terms of we suspect that you might have a certain condition, we go and find you.
Okay.
Or if we have pregnant mothers that are not coming into the clinic, we also go out and try to find you. VCT services, so they also deal with the HIV patients, and they go out and look for their patients if they're delinquent. The same with the chest clinic, the TB program. So these are conditions that we must try to address within our population.
Now let's talk about the diseases that I know most health professionals want to focus on, because it is such a critical area, the non-communicable diseases. We take so lightly these issues. You know, you have an aunt that is, you have a parent that is diabetic, another parent that's hypertensive. You may struggle with high cholesterol. And it seems to just be such a normal part of what we expect when we go to the doctor, but it is seriously affecting Belizeans.
It is.
Let's talk about what the focus has been in terms of being able to address these conditions and why people have to try to prevent getting them or developing them, and also maintaining it in maintaining a proper lifestyle if they are diagnosed.
That's right. And you rightfully said it. When we look at causes of death now, there's a trend globally from people dying from communicable diseases to now dying from non-communicable diseases. So it is now becoming a public health issue. So we need to address it. We do have an NCD plan in place for our region, which we are trying to address the NCDs. We're trying to develop a registry. So we're trying to get new cases and also know the old cases so that we could follow patients continuously. Let's speak about the new cases. For example, we've had for diabetes about 9 to 10 cases per month newly diagnosed. And in terms of hypertension, about 12 per month being new cases being diagnosed. And this is new. We're just starting this
You're
process.
just starting a regular collection of new incidents.
Of new cases of diabetes, hypertension primarily. So this will help us understand the trend within our population. It will also give us an idea of other risk factors involved. So is it that they're obese? Is it that they're eating the wrong foods? Is it that they have a high salt intake?
Yeah.
Is it that they're not exercising? You know, things like that. That's what we're trying to, the type of information we're trying to gather then to address the issue at where it needs to be addressed.
When you look at, for instance, heredity and how that plays a role or a factor, it factors into some people either being diabetic or hypertensive. Is it that Belizeans aren't fully aware of this concept of it may have been in my family and now I am prone or susceptible to it, so I must be able to take better care of myself in terms of what I eat, in terms of my workout habits and what have you? Is this?
That's the way it should be, but that's not the way people think, right?
So it's an ideal way of
so
looking at it.
they look at it as if, oh, my dad had it, my mom had it, so I'll have it too. But they don't understand that it is preventable, right? And then if you do get it or you're diagnosed with it, then you could prevent the complications of it by simply taking your medications, eating the right foods, doing exercise, right? Getting enough sleep, fruits and vegetables. So it is preventable. Either way you take it, it's preventable from getting the disease, not because my mom, my dad had it means that, you know, I will get it too. I could prevent that from occurring. And then, of course, the complications that lead to death, right?
Now I want to talk about one of the main risk factors, and it's not listed in your health bulletin, but we know we've spoken about it during the course of 2016, and that is the rates of obesity and overweight persons in the country. Last we spoke, it was 2 out of 3 overweight or obese. Are we still around the same indicators?
It's not obesity. When we look at overweight and obese on a whole, probably 2 out of every three.
Three.
If we look only at obesity, it's around 30%.
Which is 1 out of...
1 out of 3. 3 out of 10 individuals. So, and then overweight would be about 5 to 6 per every 10 individual.
Wow.
So it is a major concern. It is a, how would I say, it's an increased risk for all of these other conditions. It is the mother of all risk factors, obesity. From obesity, that leads to the hyperlipidemia, that leads to hypertension, that leads to diabetes.
So your high cholesterol, your high blood pressure, and your sugar.
That's right.
As people know them. And it is something that across the globe people are trying to bring attention to, that if you could get yourself, and we're not talking get skinny or malnourished, you're talking about getting regular exercise and eating better.
It's a healthy lifestyle. As we put it.
Getting to your proper weight and all that
That's
stuff.
right.
So that you can avoid getting these non-communicable diseases.
That's right.
Well, I know that continues to be a challenge. You guys have a weight loss competition going?
We did have. It was very effective, actually. In our region, we did it only within our staff.
Yes.
And I'd say 5 out of 10 individuals did lose some weight, and they do feel much better. They tell us, I feel much better. I've lost some weight, and I'm more active now. I could do things that I didn't do before. So it was effective. And we've seen it with all other organizations that are working towards decreasing NCDs when they speak about, doing more exercise, eating the right foods. It is healthier.
So what would you like to tell people just about what they can do for themselves in 2017 in regards to being more healthy?
Yeah. Being more healthy doesn't mean that, I feel good, that's it. What we want people to be aware of is that these conditions can be present and you're not aware of it, so they're silent. So we ask that even if you feel good, at least do one physical exam or a laboratory examination once a year, even if you don't have any of these conditions. And this is, of course, one, that you're in good health, and two, if there is something wrong, then we could address it immediately, and we don't wait until, after the condition has become chronic or a complication has developed. If you look also here, you see that the 5th major non-communicable disease is chronic renal disease, directly related to hypertension and diabetes.
Okay.
Right?
Well, Dr. Zuniga, thank you for joining us today and helping us to take a look at what we're doing within our own lifestyles and how much at risk we are for some of the conditions that you just spoke about. We appreciate it.
Thank you too.
All right, we're going to go ahead now and take a break. When we come back, we'll be talking about how to market yourself and develop your own personal brand. That's coming up after the break.